I want to bring the conversation to the topic of what we can be doing to help individual citizens improve their healthy aging. And we've heard discussion here about the physical aspects of aging, and the prior panel talked a lot about collective approaches to addressing healthy aging. But I want to spend a few minutes talking through what it is that we can do to help individuals make individual decisions that will support healthy aging. And I especially want to focus on the use of new technologies to help achieve that healthy aging by individuals. And the good news is there is a surge of innovation around us. Most of it have a version of it in our pocket as we speak. And there's great promise from a vast array of new technologies that are with us and on the future horizon. Indeed, it's hard to keep up with the state of the art, and the only thing that's sure is this time next year we will have realized we missed seeing some of the technologies that are important then. So I want to take you through some of the examples, some of the things that we're seeing in terms of this role that technology can play to help individuals. Let's just step back first and remind ourselves of why this is important, and to bring things back to the economics of aging, which begin with the demographic dynamics that are playing out. They're very clear, they're well measured and well modeled, well understood. But always useful to remind ourselves that next year or today we have about 600 million people on the planet over the age of 65. By 2050, which is only 35 years away, we'll have 1.5 billion people over the age of 65. In Europe, that means the percentage of the population over 65 will be rising from 17% to 23%. In France, that means the numbers are going from 12 million to 19 million. But probably of more interest is what's happening in China, which by itself currently has 130 million people over the age of 65, that representing just under 10% of the population. That will rise to 330 million by 2050. And that will represent about 24% of the population. So from 10% to 24%. That's the big global dynamic that will have the biggest impact on all of us in terms of the aging of the population. So how does that play out in economic terms? And we do think that it's important to run some models of what the future might look like if we don't change. And here we're just modeling what we estimate the total cost of social care and health care for those over the age of 65 might be by 2050 if current approaches to managing and supporting the elderly are maintained. And the bottom line is showing the impact simply of modeling the demographic change. The space between the blue line and the yellow line is what will happen as a consequence of economic development that would increase the level of spending on social programs and health programs with respect to the population over the age of 65. And again, the scenario is if we maintain current approaches, we'll be having to spend 6.5 times as much as we do now in 2050 on providing the support for the elderly population. Clearly that's not going to happen, and clearly there's really two ways of changing that. One is to reduce the level of services, or the second is to apply new approaches to providing the social and health care to those over the 65 in order to bring efficiencies to the system. And I would say that when we talk about the return on investment from technologies and approaches to support the aging, it's probably better to start with what will we be spending if we do nothing, rather than what are we spending today, because I think that helps perhaps reframe how to think about the ROI of such investments. So when we think about what individuals can do, need to do in order to be healthy as they age, we sort of think about 5 interdependent areas that are important. First is, of course, the physical health, and whether that be the prevention of disease through vaccination or provision of sound medical care, the management of disease, particularly chronic diseases and those associated with aging, or whether it be the provision of long-term care services, particularly for those who are unable to live independently. So all of that sort of fits within the physical health dimension here. But there's clearly also an important aspect of mental health, the prevention, delay, or management of mental illnesses, ranging from depression, dementia, through Alzheimer's and other psychological problems. There's the important element of independent living, the ability of a citizen to live independently through the provision of home care or assistance services and associated infrastructure. Self-management, what it is that a patient or a citizen can do themselves to monitor and take care of their health. And then what we call social capital, which is really about the social recognition, the education, the community involvement, the communication, the participation of an aging citizen with the broader community. So we think that it's these sort of 5 areas that need to be thought about in terms of providing opportunities for individuals to age in a more effective and efficient way. And there's a range of technologies, as I say, that are moving quickly towards us that can help with this. There's the remote monitoring and sensing technologies. These are mostly available. The constraint is no longer a technological one per se, as much as it is an adoption and a utilization one. There's tremendous technology advances with mobile health, with telehealth, with diagnostics. Social media we put in here because that can be a very effective way to enable citizens to remain connected with families, with each other, and so on. And then there's also clearly therapeutics, whether that be new medicines, new devices, and so on, all of which are available. But it's how these technologies can be applied that we think is of interest, and we think about it in terms of the sort of patient pathway, broadly thinking about the application of these technologies with respect to prevention, diagnosis, treatment, monitoring on one axis, and then also in terms of their functionality, to the extent they are providing knowledge and education to citizens, whether they're actually delivering services, or whether they're providing some sort of utility function, more of the underlying foundation for patient care. And we've taken a recent look and published a report this week that pulls out some of the examples of what we see happening around the world in terms of technologies being applied really across the spectrum. And the good news is, as I said at the beginning, there is a lot going on, whether it be the wearable devices, the remote sensing, the lower cost diagnostics, the ability to communicate much more efficiently than requiring someone to actually physically come and present themselves to a healthcare professional. Across the spectrum, we can see a lot of these advances, bringing what we would say is both greater efficiency as well as higher levels of effectiveness in enabling an individual to be more effectively engaged with their own health care. What does it take for us to really bring this all together? Again, we have a lot of technology, we have a lot of data, we have a lot of knowledge, we have a lot of pilots going on. The real question is, how do we bring this all together? And I think there's 5 ideas here. One is certainly the sense of urgency. So we can all talk about knowing about the demographic bubble and the economic consequences of it. Yet we don't do a great job of measuring it, of continuously monitoring the progress that we are making towards lowering those costs and improving the quality of the aging population. And I think this helps reinforce really there's still a lack of urgency. It's something that this sort of discussion is useful to reinforce, but we need a lot more of it. The second area we would say is the notion that healthy aging is a terrific economic opportunity for nations to harness the economic power of finding new ways to manage the aging population by bringing these technologies to bear and indeed to creating a silver economy around it. Third area, leapfrogging through technology. We would think that this is particularly of interest in places like China and to a lesser extent India, where the technology that does exist today or is very much on the horizon will enable countries to advance at a much more rapid rate than would have been the case through the application of technology to bring better outcomes at lower costs, so leapfrogging the normal development cycles. We would say, fourthly, that a priority on prevention and a priority on diagnosis is going to yield the greatest benefit, because those are the areas where we can do things at a population basis that will help reduce the number of people that will inevitably require the most expensive care and support. And then finally, funding for innovation around health aging technologies. More funding is required. It needs to be both the public and the private sectors, as we heard from the earlier panel this morning. But I think, again, to put the focus on measuring the impact of these investments is what's needed, and to measure that against what will be the total amount that gets spent on healthy aging if we do nothing. Underpinning these kinds of areas to bring healthy aging to reality is informatics and information, and in particular ensuring that we have a strong body of evidence about what works and what doesn't work, and not just at a global or national or health system level, but at a patient segment level. We know that individual patients respond differently to the same set of information and incentives and so on. What we need is a sound way to look in a more granular way, in a more segmented way at different types of aging citizens, and to be able to apply technologies selectively, or let the individuals select the technologies that work for them and that will provide them with the greatest benefit. So that requires an underpinning of information, analysis, the use of that analysis to inform decision making at the individual level as well as at the broader level. But by doing that, we are confident that... Yep.
Could you wrap up, please?
Yeah, and by doing that, we're confident that we will really be able to capture the value from these technologies at an individual level and result in healthier aging for us all. Thank you.